time, many of you are raising questions about the type and the effectiveness of testing that you're seeing available at some of the newer sites. Our 13 Investigates reporter Sandra Chapman now answers a lot of your questions and also provides some tips on what you should be doing if you're missing your results.
From the Danville Armory in Hendricks County to Grand Park in Hamilton County, questions about the lack of nasopharyngeal testing, the one that requires a long swab up the nose and all the way back into the nasal cavity. Instead, more sites are using shorter swabs to collect samples from the tip of the nostril. Alan Stoltz was surprised to see it at an OptumServe testing site. OptumServe is conducting testing at 50 armories statewide.
Tested on both sides of the nasal passages with swab, not the real long one, but the regular size.
A Hamilton County resident told 13 Investigates she was concerned and asked, are we spending millions of dollars on a test that may not be good? 13 Investigates went in search of answers. Here's what we found. In mid-April, LabCorp received emergency use approval for the first at-home sample test kit. The kit includes a specific Q-tip style cotton swab that's less intrusive. In its approval, the FDA said, we work with LabCorp to ensure the data from at-home sample collection is as safe and accurate as sample collection at a doctor's office, hospital, or other testing site. LabCorp provides testing for the State Department of Health. Self-collection kits are used at some drive-through testing sites. Officials tell 13 Investigates the nasal swabs being used are approved by both the FDA and the CDC. Just 2 weeks ago on May 5th, the CDC updated its guidance for COVID-19 testing, listing the exact specimen collections that are acceptable. A nasopharyngeal specimen, an oropharyngeal or throat specimen, a nasal mid-turbinate specimen, and an interior nares or a nasal swab specimen, like those in home collection kits. With the swabs sorted out, Hoosiers also want to know where are the results. Some who got tested through OptumServe were left waiting for more than 10 days. Stoltz was one of them.
The people who are taking care of the tests should have an idea of where the tests are after you take them.
Some good news. Alan Stoltz and his daughter finally got their test results after our story on Monday. The Indiana State Department of Health tells me tonight they are continuing to work with OptumServe to ensure those tested get their results. Now, if you have waited longer than 72 hours for results and you've checked your spam filters, we have a call center number for you. It's at the bottom of your screen and at WTHR.com.